Largest veins that return blood to the right atrium, superior vena cava. Down here, this whole large structure is the inferior vena cava. Coming off the superior vena cava, we should have the brachiocephalic vein. And there should be another split over here to the right side of the body, just not shown as well. So that's the brachiocephalic vein. Coming off the brachiocephalic vein, returning blood from the head and the neck structures, we have the jugular veins. And the jugular will have an internal as well as an external jugular vein. So this one looks to be the external, and this one would be the internal jugular vein. Following the inferior vena cava further down into the abdominal and pelvic region. Right here in the abdominal region, there would be a vein to drain blood out of the liver. So that would be the hepatic vein right here. This is the spleen. So this is the splenic vein, the blue structure here. These are the paired kidneys. So these are the renal veins. So coming down into the pelvic region, you guys can see that the inferior vena cava splits. The split to the left is going to return blood from the left leg back to the heart. The split on the right side returns venous blood back to the heart from the right leg. Okay, so now let's see, we've got to go through those guys. Common iliac. Right here, this is referred to as the common iliac vein. So this would be the left common iliac vein. This would be the right common iliac vein. Further down along the common iliac, there's a split that develops right here. This part that's more lateral, we refer to that as the external iliac vein. This split right here, we call that the internal iliac vein. Same thing on the right side, common iliac vein, internal iliac vein, external iliac vein after the split. Cakeman shows this large vein that runs down the medial side along the entire length of the leg, and this one is called the great saphenous vein. Okay, so that's it for all of that part. And then we have to do, did I give you guys a lot on this one? Let's see, subclavian we can see well here. Cephalic, left axillary. Okay, so on Cakeman, at least on the right side of the body, they've shown more of these veins into the arm. So right here we have the right subclavian vein. The clavicle bone or collarbone would be approximately in that region. So subclavian vein. Down here at the shoulder, the vein splits. This outer part of the vein that comes on the lateral side of the shoulder, that's the one we now refer to as the cephalic vein. Okay. The subclavian vein, as it extends into the armpit region, we now refer to that as the axillary vein. So there's the armpit region. And then the vein continues down along the length of the upper arm, brachial vein, the brachium upper arm, so brachial vein. And then down here at the crease of the elbow, you guys can see there's another split of the vein into the radial and the ulnar veins. So let's see, here's the thumb. So the thumb should align with the radius bone, right? So this should be the radial vein, and this would be the radius bone. And then this medial part aligning with the pinky finger, this is the ulna bone, so this would be the ulnar vein. And then in the palm there would be a palmar arch where the radial and ulnar veins join to form a little arch structure. And I think here we're just seeing part of the palmar arch vein. And then coming off of that arch structure, we have the digital veins. And those are veins routing out to each individual finger. Let's see, so that's it for that guy. Let's look at your image there and see which ones match up with the veins in the leg here.
I made it child appropriate because I have kids.
Oh, that's what the... Don't you think they're going to want to take that? The girls are going to want that heart, though.
Well, I have a
And then they're
little
going to be
one.
like, oh.